Good evening, everyone. Today is June 18th, 2024, 6 o'clock every Tuesday night, 6 to 7 o'clock. We meet to ask the doctor anything, and I'm Dr. Ellithorpe here at Tustin Longevity Center in Tustin, California, Southern California. And we are entertaining questions about functional medicine, general health, preventative health, restoration of health. And we are a group of 6 or 7 healthcare providers. We're trying to take the best of our standard allopathic medical school training and merging it with the best of all the ancient knowledge and wisdom to help the patient achieve their best health here, to serve their families and their communities and help one another. So we have a series of email questions. These questions you can get on tlcdoctors.com, tlcdoctors.com. And if you get on the newsletter, then you can find the link for our Ask the Doctor question, and you'll get notifications. On that notification in the email, you'll get a link. On that link, then you can type in your question. We will then put that up today. I haven't had a second free today to even take a peekaboo at these, so we'll be doing this all blind together. I'll do my best at trying to answer these. I'm a general practitioner, family practice, and we will also have the YouTube. You can type in your question on the live chat as well. I try to get to the live chat those who are actually watching. If this is of value to you and you enjoy this or this additional resource, then please like and subscribe, share it with your friends. We are not trying to replace a doctor's visit or give personal advice over the phone or the video venue. Rather, we're just trying to talk about these symptom questions and how we would generally think about it and approach it, what our thoughts are in general, our experience as well. Thank you very much. So we have quite a few pages. So I'm going to start right off here. The first one is from Christina. And Christina says, would you suggest having dental x-rays done as often as a dentist's offices do them, or only once every 5 years? Christina, it depends on how much, what your jaw situation is, what your dental health is, what the proposed treatments are. I am not a dentist, and three-dimensional x-rays, they are always monitoring the radiation exposure. We don't want to do them frivolously. They do keep a record, and the record will show a summation of the doses or sieverts that are you're exposed to. So I'm going to have to say, Christina, it depends on all those factors. Usually you can get away with it infrequently if you take good care of your health. One of the things I find very good is Juice Plus has 2 dental schools, one in England, or maybe they're both in England, but they have 2 well-renowned medical schools that have reported on the periodontal disease, the gums receding and the pockets being very deep. And after 28 days, I believe the study was, they actually saw a reduction in the pocket size. It could have been longer. But I do find most of my patients use Juice Plus for the multiplicity of value of having an antioxidant to prevent free radical damage, plus all the micro trauma of your chewing. Now remember, everything is about having this injury to your gum. That's a micro trauma. Even your toothbrush, if it's too tough, can harm it there. and then you have to get it healed, from here to here, and you heal overnight. And that's why we need our bedtime, our sleep time. That's why we need to avoid sugars, the acidity in our mouth. Sugars make acid. Acid then helps erode the enamel and then into the dentin, and then bacterial invasion into the tooth and so forth. So we do recommend and have seen, and I don't have my patients really complaining. I always check their mouth. I think a good doctor who is going to do a wellness check should look from your head to your toe and look at your gum line. It's a clear indicator because a lot of disease will affect even cardiovascular and the rest of your health. So I don't have a lot of patients that I find that are not taking care of their teeth because I look at the gum line as far as your ability to heal the micro trauma of daily life. So Juice Plus has very good research data on that. And I have to go where a nutraceutical has the highest standard of uh, scientific studies by a valid institution, controlled placebo effects. And that's why I have to recommend it. And brushing your teeth. I use silver in my toothpaste. I use Dr. Jones. I get it off of the Alex Jones Infowars.com shop, drjones.com, I think it is. And he has a charcoal mixture with silver in the tube. And he has bamboo brushes with camel hair. And so that's what I brush with morning and evening. And then, I'm a carnivore, so I really am not eating sugar or starches or ever. I don't eat fruit or juice. So the content of the sugar should be very low, and I'm pleased with the impact of that product very, very much to the point that I'm now starting to recommend it. So hopefully that gives you some idea, Christina. Talk with your dentist. Let them know that you're aware, and just the mere fact that you bring it up with them, your dentist will be more retrospect. Does he really need that X-ray or not? Mona says, "Hi, Dr. Ellithorpe. I appreciate you so much." Well, we appreciate everyone coming on this channel and encouraging one another to be healthy for whatever God's work it is we have to do each day, building his kingdom. Your first question is, what are your thoughts about coffee enemas? Are they good for detoxing daily toxins? Because I have been around this over 50 years or more. Remember, I was 4 years old in my dad's food research labs, and I've been hearing, thinking, and been in the world of food research and detoxification since my earliest recollections. I have to say, I've always known about coffee enemas. It's a cholinergic, and it helps the bile secrete, and that helps to move along and your fats and your bowel movements and stimulate your bowels to move, plus the volumetric stimulation of just the volume of the fluid going up your rectum. But I have never seen it be a impactful therapy to the point that I'd rather see someone get up in the morning and get in the sunshine and get their feet bare, standing in the wet dew grass, for 10 minutes, than fooling around in your bathroom with bags and tubes and coffee and making sure it's cool enough so you don't burn your back end with too warm of a coffee. So that's how I see it. And she has the second question. Do you think medium chain triglyceride oil is good for us? Does taking MCT oil cause elevated cholesterol or triglycerides or anything? No. Does it cause weight gain? No. Which what do I think it's good for us? It can work as a promotion of a ketogenic type lifestyle, carnivore lifestyle, to help suppress cravings. Fats are a natural appetite suppressant. You'll see healthcare providers bring up taking olive oil or putting butter in your warm tea or coffee. So MCT oil can be put in your warm tea or coffee, or you can take it straight into your mouth. Yes, so if you're having dry mouth, you could take a teaspoon of it at night or of olive oil, and that helps to keep the moisture on your mucous surfaces of your mouth and tongue better. Then she says, which progesterone cream do you use? Thank you. I use progesterone, natural progesterone bioidentical powder, and we mix it here, compounding it with eucerin cream. So that's essentially what it is. There's no, fillers. There's no pretty smells that we add to it. Nothing. It's just the basic cream that we mix the progesterone into. Now I do buy over-the-counter Kokoro balanced progesterone cream. I've used that, I don't know, 35 years. And it is a pumper thing, and it is a very low dose, whereas the standard cream we make is 200 milligram per milliliter. And if it's in a topical thing, where every click, 4 clicks equals 1 milliliter. So that would equal, now I got to do math, and I've had a very hard day. So there's 5 ml. Let's see, 1 ml is 200 milligram. 1/4 of 200 would be 50 milligrams per click. But if you use the balanced progesterone cream, there'd be somewhere in the neighborhood of maybe like 13, 15 milligrams instead of 50. I often have the high school girls use the balanced progesterone cream, and from day 15 through 25 of their cycle. Hopefully that helps you, Mona. Slovig says, could you please give us a quick rundown of what your day looks like from waking up to going to bed, as far as the names of the supplements you're taking, when you take them in accordance to your meals, food you eat, and workout, sleep schedule. I watch you every week, and I try to write down your daily supplements and schedule, but fail. Yeah, and this will be transcribed also. So you can look for the on our website, tlcdoctors.com, the typed out portion of this. So I usually get up around 5 o'clock in the morning, and I, of course, go to the bathroom, and then I will fill up a 2-liter bottle of water that I have as a vortex. I sit it on an energy pad to make structured water. But the point is, I want to drink at least 1 liter in the morning before I go to work. And that sits on my desk, swirling at home. And then I make my coffee, and that smells real good. And my rule is I can't drink the coffee until I drink my water. While while my coffee is being made and my water is filling up, I put my vitamins together in the morning, and it starts with my Vitalzyme. I take 5. Then I take my quercetin in the form of DHIST seasonal relief. That's our brand name of the same product. I'll take 2 of them. That gives me 400 milligrams of quercetin. Then I take Spore, IG Spore from Orthobiotics, 1 capsule. Then I take my TLC Energy Core, 2 capsules. Then I take the B complex, TLC methyl B complex, 2 of them. And I take the clinician's preference oil for the linoleic and alpha linoleic acid oils. I take 4 of those capsules. Then I take a Juice Plus, my green, red, and purple, all 3 kinds. Then I take a DHEA 50 milligram. I take an iodoral, 1 tablet. Then I take my thyroid tablet in the morning. Then I take my N-acetylcysteine 500 milligram tablet. Then I take my, what am I missing? Oh, my TLC multiminerals, I'll take 2. And then I take, I think that's it. So that's all in a little bowl. And then I go sit down and I read my Bible for about a half hour to an hour, my quiet time with the Lord. By that time, the sun is coming up. Then I go outside. I have my earbuds in and I start listening to some science or some Bible or some, news update. And I have my earbuds in and I step outside into the moist morning cool grass with my bare feet. And I just stand out there a few minutes, maybe putz around looking at my flowers. And I think about God and my day and what I want to do. That's when I talk to God and ask for his wisdom. Then I come back in and I start making up my dog food for my dog. And then I, of course, make my bed, set out my clothes, get my workout clothes. My workout is doing a heavy weightlifting, upper and lower body 3 times a week. Tuesday nights, I always do it tonight. I didn't change yet. I have my clothes in that red bag there. That's all my stuff I'm going to change into as soon as we're done here. And then I'll be there till from 7 to 8. And then I just go home and relax, try and get into bed. But I will take before bedtime a second set of 5 vital sign. I'll take 1 probiotic. I will take N-acetylcysteine, my second 500 milligram. I'll take my third or 1 capsule of my TLC multimin. And that's about it. And so I have the other liter of water to take in my structured water. And so I get at least 2 liters in by purpose, and then I get a little bit at work here. So I'm always getting in over 2 liters a day. And then I sleep like a baby. I use my hormones in the morning. I forgot to mention that. I do that with my teeth brushing in the morning when I get dressed for work. Then I try to get on the treadmill Mondays, Wednesdays, and Sundays and walk a couple miles while I'm listening to some technical, scientific, or biblical apologetics or something like that, or some current events issue. So those are my 3 topics. And then I repeat it every week, 52 weeks out of the year. And once in a while, I'm blessed of the Lord to have a hot tub. And I have my sauna, my infrared sauna. I use Sauna Sure. Sauna Sure is, no. Sauna Space. Sauna Space is what I use. It's a canvas with the 4 infrared lights, and I'll stay in there maybe 30 minutes after I go in the hot tub. But I have to admit, I don't do that as often. I'm trying to build that up to 4 times a week. And my diet, I usually eat, I'm changing up so that if I eat in the morning, I'll have eggs, or I make up pre-made up hamburgers. I make up ham on Swiss cheese with a little mayonnaise. I'll have deviled eggs, hard-boiled eggs. I'll eat a regular meal, and then I bring some to work, and I make up these cupcake cans, and I put the hamburger in it so that the cupcake, instead of a cupcake liner, I have a liner of hamburger. And then I'll put a chunk of cheese in it. I'm B positive, so I can handle dairy digestion very well. And then maybe I'll put just a dollop of pizza topping, the red base on that. And then I'll bake those. I bake my chicken. I bake my thick bacon and my chicken legs, and I'll make dozens of these. And I put them in bags, and I'll show it to you just a minute. Let me get it out of my refrigerator. So I don't think I brought one of my cupcake things, though. So I actually made up little meatballs. So these are my meatball things I have for so I don't get tempted to eat anything else. I go to the Sprouts and I get my ham slices, and then I'll put a little squirt of mayonnaise on it, and then I will probably get a slice of cold Swiss cheese, and I'll lay the ham on it, and I'll put a little line of mayo, and that'll be my little treat of food. Let's see, what else might I eat? I might have some plain yogurt. That's it. Maybe on the weekend, my husband will take me out for a steak and eggs, or short ribs, and I just get the beef. I don't take the vegetables. I'll take the salad. Once in a blue moon, I'll have my broccoli with it, and that's all I eat. And that's how I can wind up having a fasting blood sugar of 55 to 62 range, and all these good numbers. And Lord willing, I'll be here for another good long while. That was a long answer, Slovig, but you got it out of me. Gwen, hi, Dr. Rita. Would you use any Chinese herbs or homeopathy to treat a persistent hemorrhagic cyst? I developed a cyst at age 39. That's an ovarian hemorrhagic cyst. After beginning Armour thyroid, I don't think that's related. And after 3 rounds of fertility hormones last summer, it gradually got worse. Now I'm off all meds, including Armour. This month I had spotting for 10 days after my regular cycle ended. Thank you. Gwen, I would want to know, if you were my patient, your blood type. Insulin is the stimulant for ovarian cysts to grow. Polycystic ovarian disease, PCOS, is another feature of the metabolic syndrome from too many carbs. So if you wanted to get pregnant, I would be a carnivore, or as close to a carnivore. And I really mean it. If you want to get pregnant, I would use progesterone, 200 to 400 milligrams, day 15 through 25 of the menstrual cycle. This is what I would say to any woman with this kind of scenario, given everything else is healthy about them, or stable. Then I would have them drink half their weight in ounces of water. I would tell them to have a healthy cycle, get up in the morning, go to bed regularly, 9:30 the latest, and then to exercise and use a good multi-mineral chelated with amino acids, organic molecules. I would have them use Juice Plus. I would have them use iodine, and I would have them use the iodine, Vitamin D, I would have them at least on 10,000 with K2 because K2 is really another fertility support. I have never used homeopathy, and I've been very successful helping women. And you don't just try this; you have to live this lifestyle. Uh, and once you're healed, then you should be able to, after 6 months pure carnivore, maybe you could add back in some vegetables, but be very careful. But anyway, talk with your doctor about that. That's how I would begin with anyone with those similar type questions. Wendy asked the question, uh, what is the best topical magnesium to use before bedtime for optimal sleep, anxiety relief, and improved energy for the following day? What are the side effects of using topical magnesium product? I also heard it can balance hormones, especially cortisol levels. Is that true? I never know what to believe on the internet these days. Wendy, I've never used topical magnesium. Some people take Epsom salt baths, which is a magnesium oxide, high dose magnesium in the water, and your skin absorbs it because the water is warm, and your skin is a medium to absorb this. But again, I don't like getting my skin wet very often, and especially the older I get. And my oils in my skin, I work hard to produce to stay soft and keep the integrity and the thickness of my skin. So I don't like that. I would use oral forms. Magnesium, we use OptiMag Neuro. That's a amino acid chelated magnesium. There's 4 grams of magnesium, I think, in it. No, that's the Vitality C that has the 4 grams of vitamin C per scoop. I'm not sure if it's a gram in the one scoop of the magnesium or somewhere close to that. Magnesium is involved in so many biochemical interactions. Remember, the mineral ions are like God's pots and pans that he uses to attract because it's charged. All the minerals are charged. And all the amino acids and fatty acids have charges too. And some of them have various areas on the thing that will attract to the charge of the metal ion or pot and pan. So when he wants to bring 2 things together and create a new molecule or so forth, he'll often have that magnesium involved, although there's other minerals involved. And I just don't think that it needs to be more complex than that. If you're a blood type A, digesting and absorption is more difficult. Find out your blood type. If you are a type A, you would take your minerals during your meals because you would take a digestive enzyme with extra acid in it. So you have to have a doctor with some experience, or they have to have medical schools or natural training centers that have medical doctors who see real disease that help train them. So that's why I do these programs, so that maybe some dear doctor out there might benefit, I hope. So that's about the best thing. Magnesium is a muscle relaxant. Magnesium has therefore a calming effect, a blood pressure dropping effect. Magnesium is involved in so many chemical reactions. You could claim that it's the end all be all. It's one of the most deficient minerals in our diet. So especially in A's. Therefore, that TLC multi-mineral that I made was designed for the diseased low general food content of magnesium. And I think all my A's, and I would say 80% of my patients are blood type A because they have all these symptoms. So, Wendy, hopefully that helped you. Diane, Dr. E, could you elaborate on how DHEA plus vitamin C IV reduces CNS inflammation, especially since a family member has been diagnosed with arachnoiditis stemming from the L2L5 region, that's the lower back lumbar spine. His pain is severe down his left thigh. It is critical to reduce inflammation under 90 days from the onset of pain so it doesn't turn into adhesive arachnoiditis. Again, the most anti-inflammatory diet is a carnivore diet. You just have to swallow that pill and deal with it because it's the truth. We are composed of fat and protein. Every cell membrane that you want to turn from this situation into the healthier, cell membrane here, over here, depends on eating enough fat and protein in general so you can fix all these injuries. And that comes abundantly, massively nutrient dense, satiating, so that the carnivore diet is tremendous for cell membrane repair, and that will seal the irritation, inflammation sites of those injuries to the cell membrane. I'm not saying you can't, everyone's different to some degree. Maybe you can still heal with some very basic cruciferous vegetables, sulfur-rich vegetables. But there's plenty of sulfa in crustaceans, lobsters, meat, fish, chicken, turkey, beef, eggs, especially in eggs. So you wouldn't have to rotate them so much as a carnivore because it's so healing. When you add in plants, when you add in fruit, you're adding in something that you're not structurally made of. The fruit, the vegetables contain micronutrients, prebiotics, in it, minerals, vitamins that our body can use. The B vitamins, minerals, antioxidants, all kinds in the colors, the wide variety of colors. But we are not composed of those things. And our body can get really everything from eating a pure carnivore diet, to include vitamin C, especially if you include organ meats. That's why I try and include liver in my diet. So I'm going to say you have to just get all the main source of entry for inflammation in the body is what you put in your mouth, and it gets into the lining of the gut, and that gut lining gets scratches in it, and that scratches allow breaches into the lymphatic. The lymphatic makes antibodies. The antibodies call for an immune response, a healing inflammatory response, and that's what creates damages to that area here. And that's why I like this picture, because it's all about that no matter what the disease is, this is what's happening to you. And if you can get in your mind, that's what you're working on. But you cannot make a baby, it takes 9 months. You can't make it in full baby in 2 months. Now with our great, wonderful technology in medicine, and I praise them for that, the rescue technology of neonatology, we can almost even save a 6-month pregnancy. But you have to understand it takes time to heal. So if you're going to embark on this, one of the things I need to get over to my patients and to the people is this is a process. Like if you're going to go to class and you want to become a chef, you're not going to go in 4 weekend visits and become a chef. You'll get some skills, but you're going to be handicapped and not the best you could be. You're going to go for a series of months, usually for whatever it is, or years, depending on your end goal desire of profession. And I'm telling you, healing takes at least a commitment, carnivore wise, of 6 months, somewhere in that range, maybe even 9. And you can't make self excuses. You have to say, am I going to do it or am I not going to do it? Am I going to pass my driver's test when you're 15 and drive? Well, you're going to study, you're going to do what you have to do because you want that license. Well, do you really want that health? Do you really want to bring your body into its 60s, into its 70s, where I'm at now? And I want to bring my body into my 80s, into my 90s, and even into my 100th birthday up to, I have this artificial number in my brain of 112. And I want to work. I just want to be here helping people. Why? You guys are so interesting. And I shouldn't say guys, you ladies and gentlemen, and young people and old, both. It, to Humanity is magnificent, and I'm here to try and take hands with you, like the Holy Spirit comes inside or comes along with you to help you, to help you. And I haven't done things perfectly. I have fallen. I have tried things. I've gotten frustrated. I've yo-yoed with my weight. I've done my exercise and I didn't do my exercise. But now I have my grandchildren to live for, my children to live for, my nieces and nephews. And I feel that the world really needs the knowledge, the history I have, but it also needs the knowledge and history you have. You have experiences, skills, a unique personality, a background. We're all so special. We all are such tools in God's hands to help our neighbor, to help our family. And I think you are all worth it. And the more I study the Bible, the more I'm humbled. God didn't take the wealthiest, handsomest, most beautiful damsels to do things with. He took a harlot, Rahab, and she's the great great grandmother of King David. For heaven's sakes, the first human being to see the risen Lord was Mary Magdalene, who out of which was cast 7 demons. So I don't want to hear about anybody who is inferior or my body's not worth healing or I don't have enough to offer my friend or my neighbor's child to help them or inspire them. We all have gifts. We all have value. And we need to be little, when I was a young girl in the 1950s, there was this little machine at the drugstore, and I don't know, you press something and you would pop the top and out would come like a little sugar cube, a dispense machine. I want us all to be dispense machines of the respect for our fellow man and their value and to encourage them in doing the best. And it just grows. And so, early in the Bible, it talks about in Acts, the rulers of the cities say, these men have turned the world upside down. So Jesus started with 12 disciples. And, within 10, 15 years, the whole environment there was impacted. Excuse me. I got to shut this off. Okay. And so, yeah, it does matter. And it's that old negative devil that's going to say that you can't fix that chronic leg ulcer from your diabetes. You can't get your memory back from your faulty memory. You can't get back outside and play with your grandchild because of your joint pain or various things. The answer is actually yes, you can. And that's what I want to be and encourage you. So how does DHEA help? Dihydroepiandrosterone is a natural precursor to your adrenal cortisol, which is an catabolic hormone from your kidneys. And DHEA is making sure that you have enough cortisol at the right time of the day to wake you up, to respond to a stressful situation, and to replenish and heal you. Dihydroepiandrosterone Androsterone is a testosterone precursor, especially for women. So, when I do my weight training today, I take my DHEA. I don't use the cream of it, although I could. It turns into testosterone in me, and it gives me, an extra, 50, 75 milligrams per deciliter. And I have good strength. I really have very good strength. So that helps me with my motion of life. So I believe in that. Now, vitamin C is probably one of the most universal antioxidant, especially if you get at high dose vitamin C. It works as a prooxidant to kill off, abnormal opportunistic fungi and bacteria and viruses. Klenner, Dr. Richard or Robert Klenner in the 1950s published in the New England Journal of Medicine, and it was evaluated by several doctors. I think he was in North Carolina, and he just cured every single one of the little children, 5-year-olds and so forth, that had the polio virus paralysis, and would have gone on to, the lung machine and died, neurological nerve damage, lifelong trauma, limitations. And he did it with, I think he was using somewhere in the realm of 375 milligrams either per pound. I'd have to check it. I was just doing reading on that. And when I do so much reading on it just recently, I get my numbers mixed up. I'll have to check it again. But at least 0.5 milligram per kilogram probably is what I would think. And they all 100% got better. So is vitamin C valuable? Yeah. And do we make any vitamin C? No, not at all. Now, if they had arachnoiditis, they should also be on systemic enzymes to be the little Pac-Man that chew up the dead cells and disinflame the body. And then he's got to drink water, and the patient has to get grounded so that the electrical balance of the body's electrical membrane difference between the inside of the cell and the outside of the cell, that membrane is a battery, a potential of 90 millivolts. And if that drops, which it does with aging, it can turn to cancer at around 50 to 20 millivolts. And then beyond 20 millivolts, it dies. So you need to work on repairing your membranes so you stay alive and have memories and good eyeballs and good lenses. And then chelation therapy improves the tiny, tiny microcirculation that will get deep in penetration to get the vitamin C in deeper, to get the enzymes in deeper, to get the water, structured water, filtered water deeper into the tissues, your nutrients deeper into the tissues. And there won't be any competing dust or debris or blizzard of food reactions or activities if you do a carnivore diet. That's how I would begin it, and that's how I do everything. So it isn't like this is rocket science, people. This should be taught in every medical school, and we have success after success here. Now, my ALS patients have all passed, but I think the life expectancy is 2 years, 3 years, and then 5 years is remarkable. But mine tend to move into the 8 and 10-year realm. And so that is certainly of value. Chuck says, how would I reduce inflammation as well as carpal tunnel in my wrists? I have been with this pain for over 4 years. Chuck, just refer to the answer I gave to Diane about arachnoiditis, because we don't heal differently in our body. There's a healing way. Narrow is the path that you have to go. You just have to do this. You have to make a decision. Do I want wellness? Or are you going to play around and cheat and then blame the doctor or blame, the situation, or this happened in my life? No, if unfortunate things happen in your life, you don't have to start having get off your carnivore diet. For instance, if I travel, when I eat carnivore and I'm in an airport, I'm not going to go to some walk up place for I don't know what you call those little kiosks. I'm going to try and find a restaurant where I can sit down and I can tell the waitress, could you scramble up some eggs and put a lot of butter on it, and maybe some bacon or sausage, or maybe if it's evening, I'll say, could you get a steak? I don't want anything else with it. So there are ways to stick with it and do it. All right, Simone says, hi, Dr. Rita. Once again, thank you for taking my questions. I live in South Florida and the weather has been very hot. So when I receive my supplements from the TLC store, the mail truck doesn't have air conditioning and my supplements are very warm. Will that affect the efficacy of the supplements? Well, when they're in motion, in the sense that it should take 2-3 days, they're not sitting there for. If it took a week, 2 weeks, then it's stuck somewhere, and God forbid it's sitting on some pallet on the outside where the sun's beating down on a docket somewhere. So no, that shouldn't happen. Just put them in the refrigerator initially, and the box, and then put it into your drawer. Try and keep it sealed and in an environment, air temperature somewhere between under 85 degrees or lower, and it should be just fine. Then the next thing is, let me go to some of these live questions here. Elizabeth says, hi, Dr. Rita. Last week you talked about nicotine helping with ALS. My sister died from ALS 10 years ago. Now have a cousin who has it. What type of nicotine can you buy, or is it prescribed? It's over the counter. It comes as a gum and it comes as a patch. And there's only one kind of nicotine. Nicotine is a unique molecule. And if it says nicotine, it's usually 2-4 stick milligrams of gum, little like dentine gum. Or the patches come, I think, 7 milligrams, 14 and 21 is the highest amount for the nicotinic receptors. So do your research on this. That's what I'm currently studying. I'm not telling you 100%. I can quote some reference laboratory paper, scientific paper on this. I read so much, and usually what will happen is, I might have covered 15 topics per day in my brain, and I just love to study. So I don't have a nicotine ALS report, but like when I'm done here, it'll bug me, and I'll go home tonight probably, and I'll probably putz around in my scientific paper web research sites and look for something like that. But yeah, it's over the counter, and nicotine is nicotine. There's no different variety or various types. There's only one type. But if you do all these things with the ALS, as with the arachnoiditis, all disease is the same picture, everyone. Everything is the same picture, a picture of injury and then a picture of healing. And you have to eat the stuff to repair your membranes, drink the water to bring the nutrients and have the water to take the debris away, get the enzymes in there to chew up the debris, get yourself to bed at night to give a consistent time for healing to take place, drink enough water, take the antioxidants. Once you build something, when there's a lot of damage, when you build this damage here, once you fix it, you then want to put a shield around it of antioxidants and good hydration. And that's why the antioxidants help, repair. Like when you're building a house and you're putting up a beam, you'll put a striker on it so it doesn't blow over. And antioxidants are like shields to help your construction site until it's more finished. Because everything matters. That's why you matter. That's why every job that's done on this planet matters. That's why every word you speak matters. I'm not saying you don't call out an error when you see it or correct your child or be honest with your spouse about something that is upsetting you. But there's a way to speak life and truth and love. And then there's a way to just couch in a clever, cheeky kind of way your hurt, nasty feelings and tearing down someone else sarcastically. Please, let's get that guile out of our mouths and let's realize we're talking to God's creation. And hopefully everyone can start coming to a more blessed, healing, wavelength, peaceful time and help one another heal. I mean, we could go into the body electric. I read that book 40, 50 years ago when I did my second doctorate in integrative medicine. We are vibrating all the time. We're healing, and you have to work with the rhythm of the cycle of the sun and the moon. You can't fight these cycles. And with all these electronic waves, I like my Faraday cage I have in my bedroom with my drapes over my sauna, which is it has the little copper threading wire in it. So I can get to a spot to listen to things and be peaceful without electromagnetics, the blue light coming off the computer. I make sure I get the blue filter on my glasses. Everything matters. Every good thing I do for myself will help keep me alive to serve you. And I am honored that you hire me by coming here, and I can try and use all my experience to try and bring whatever I have to offer to help you. All right. The next question up here is Kim. I am a patient currently on estrogen patch with progesterone pills. Is it better to use estrogen cream on my face? Would I get additional benefits like firmer, softer skin that way? It's likely. I mean, are they ever going to pay for a study on that, Kim? They're never going to pay for a study. But I use my estradiol to my face as a cream. And I use anywhere between 1 milligram, which is just one click of my 4 milligram per ml topical. And if I have a 6 milligram per ml topical, because I'll usually use discarded or damaged things here. If I use one click of that, then I'm getting 1.25 milligrams. So it's really safe, healthy ranges. It's nothing way out there. And we test your blood. And I put it all over my face and my eyelids and around my nose to help try and keep my complexion or my skin tighter, because I don't have any facelift. I don't have anything fake in me, bolts or little bags or anything like that. I am who I am. And I do like the cream for that reason. And my clinical experience would say, yes, I think the cream would be better for that. So when you come to your next visit, talk with your doctor and make the switch and then get it tested then. It takes about 4 months to bring up a new layer of skin. So don't judge it in weeks or days. We're all too impatient, Kim. We are all too impatient. If you're going to test anything on hormones, you've got to wait a minimum of 4 months. Deanne says, Dr. Rita, can you recommend targeted red light therapy for joint pain relief? Yes, I can. By using this LED and laser therapy, I could possibly avoid knee replacement surgery. Yes, it's possible. But again, I would employ everything we've already said about how we're trying to heal and repair. Okay. You have to bring all these things. They're all equally important. And then the red light therapy has a wavelength that will get deeper into the tissues, which will enhance the microcirculation. And I'm always for EDTA chelation. I am always for IV EDTA chelation. And that will help the cartilage, which is avascular. There's no way you can get that cartilage help unless you drink enough water and all the other capillaries in your body are open. And like the skin on my ear, the skin on your nose, the only way that's going to get the cartilage in your nose so it doesn't get stiff with calcium and break is if you have good circulation in your skin here, and with good circulation in your scalp and you eat enough protein, hopefully you'll grow better hair. And on it goes. Beagle Mom says, what is the test for insulin resistance? Thanks. I do it on my patients all the time, and I have for almost 35, 40 years now. I do the lipid profile for the triglycerides. I do the hemoglobin A1C for glucose sticking to the hemoglobin protein. And that's just where it tests the hemoglobin and sticking to all the others. I do the insulin fasting, and I do a comprehensive chemistry for the fasting blood sugar glucose. So if you multiply the fasting blood sugar times your fasting insulin, so let's say your fasting blood sugar is 100, which the foolish, dumb labs and uninformed doctors out there don't get it yet. A 100 for a fasting blood sugar is no bueno. Nor is a 95, nor is a 90. That's not good. Why? Because an insulin, I've seen insulins as high as, in my group here, 20, 19, 10. And if you take, let's keep the figures down for my strained brain at the end of the day. Let's say your fasting blood sugar is 100. And let's say your fasting insulin is 4. 4 times 100 is 400. And then with a lot of scientific and data scanning, the denominator number is 405, 405. And then that number should be multiplied and divided by that, and it should be about a 1. If you're a 1 or less, you do not have insulin resistance. And I'm telling you, the vast, vast, vast 90% of everyone has blood sugars that are higher than that. And that's the precursor for your cancer. You're asking, where did the cancer come from? It came from decades of you having fasting blood sugars at 96 and insulins of 7. Okay? What's 7 times 96? Well, that's, like 680 or something like that divided by 400. Well, you're over 1, buddy, So that's where the disease promotion occurs. Deanne Smith says, have you heard of the company Kieon? No, I haven't. Beagle Mom says, what is the test for insulin resistance? I did that one. Okay. Robert Pinsky, question about trigger finger on my index finger. I have taken physical therapy and have range of movement back, but it still clicks. I've always taken Vitalzyme and drink lots of water. I take extra B. I don't know what P5P is. What else can I do? They say either shots, which creates scar tissue, or surgery. Can I do something less evasive? Why don't you maybe try and drink some structured water? I would have you go to Dr. Pollack, Pollack, PhD. Put in Dr. Pollack structured water, and then you can learn how to make structured water in your own home. You could buy a device like I have. I filter my water in a Berkey filter that I buy from InfoWars, and then I take that water and I put it in my water flask. I have a crystal water flask, but glass is fine. And then I have a swirling device magnet on the bottom. So it's always in motion, because healthy water is always doing right angle turns and bumbling down the glacier streams. And learn about structured water. That has tremendous healing benefits. And then maybe get an infrared sauna, near infrared sauna space is what I use. Because when I go in there for 30, 40 minutes, I take my temperature with a oral mercury thermometer. And my temperature is usually like 98.1 or 97.8. I'm always in that range roughly. I'm hypothyroid. And then by the time I get out of that place, 30, 40 minutes, my temperature is like 101. And so I have all these heat shock proteins and all these healing stimuli, growth hormone stimulation, and I feel so nimble. If something hurt before I went in, it doesn't hurt when I come out. Maybe that'll help you, Robert. Beagle Mom says, Dr. Rita, please tell me about your dog food. You know, I wish I made a lot of money, but I am not a wealthy doctor. I am a middle class doctor. I can't afford vacations. I can't afford a Mercedes Benz. Maybe technically I could, but I have other things where whatever excess money I do have, it needs to go. And so my 2006 is just good. Saturn, my 2006 Saturn is good enough. And I made my old GMC van, 1989. It finally broke down in 2011. And I drove it all those years, a little over 400,000 miles. So when you say, what do I get from my dog? I get my dog, I think it's called, I don't know what it's called, Scientific National or not National Scientific. And then I buy Purina little pouches of meat. One's beef, one's chicken, and I think one's fish. And I take a little scoop of the kibbles and then I put one pouch on it and warm water, mix it up. And I only feed her little pieces of meat throughout the day as rewards, because I'll have leftovers from all the steaks and stuff I make, eggs or my sausage links or whatever. And that's all she gets, one meal a day. And I usually, I'm trying, I feel I want to heal better. So right now I'm trying to eat twice a day lately instead of one meal a day. I'm trying to eat between 7:30, 8 and like 1 or 2 o'clock. Okay. I want my baby to eat the very best ingredients. Thank you. I'm sure there's better. And the more you can get that dog, if you can afford all meat, for the dog, then the better off they're going to be. Nida says, what causes severe leg cramps? Is it the lack of magnesium or overuse of magnesium? Here's the cause. This is it right here. The older you get, the more damage to your nerve and the myelin sheath around your nerves, your cell membranes. You leak out of your cell all those wonderful nutrients, and then you become mineral deficient. It becomes irritable, and then you can get dehydrated. You leak the water out. I'm telling you, every disease starts at the cell membrane damage like that. Eat meat, fish, chicken, turkey, beef. Take your enzymes. Take a good methylated B. Take Juice Plus, an antioxidant, at least the red and the green. And then take a good multivitamin. I recommend our TLC multiminerals, 3 to 6 a day. That should solve it. And then exercise and stretch. I do Pilates and stretching. Mary says, what's the best form of magnesium for blood pressure? Water, really, it's water. And then take TLC multiminerals, and then exercise and get on a good routine and get your blood sugars down. G says, really needed to hear this. G, thank you. Okay, amen. Praise God. Gina says, Dr. Rita, it has been proven through case studies that the LifeWave X39 combination with the X40 has a Faraday cage around your body in addition to improving your bones. And that's true because there are crystals in those LifeWave patches, like you put one on the back or you can put it on other parts of your body. And your own infrared body heat, we're always radiating out energy, and that will heat up these patches and the minerals. and they will communicate. Literally, we're communicating right now through electronics, wavelengths. But even your mind, there's the argument that water has memory. I mean, I could tell you some mind-boggling research on, you know, uh, the Nobel Prize winner who just died months ago, Montagnier. He validated that structured water carries memories, and that's how you can, even over a computer, drive, put in a little flash. Uh, it's getting too late, and I got to get to exercise, otherwise I won't wake up tomorrow. But anyway, that's what I would do. And then Gina says, let's see, in addition to improving the density and so much more. Yes, so you can look into LifeWave. I have them at home. I can't do everything. So, I've already gone through that phase. Oh, I'm going to do this or I'm going to do that. I'm going to buy money on this. No, nothing more important than your purpose. Your purpose is to take care of yourself. For me, it's to serve and build the kingdom of God in my family and friends and anyone I can help. That makes me want to take care of myself so I do a better job. So, you will be a better parent if you take care of yourself and model that good discipline to your child. So I didn't get to all these questions here, ladies and gentlemen. I can only do so much. So I have, a little bit more to do. I'll do it next week, and we'll go from there. So I wish you and pray for your blessings, and that you're prosperous and you feel motivated, and you can really see the value in you, because I do, and I know God does, and that's what it's all about. So let's love one another, and I'll say good night. See you next Tuesday. Like and subscribe. Please like and subscribe and help us out. Thank you so much. Let's see. We'll go down here. Here we go.